There are a few key patient reports that, if pulled, will help you better manage your patient data. To access your patient reports, click on Reports and then click on Patient Reports. The Patient Master List is a report that shows your patient's name, address, telephone number, policy numbers, and so forth. This report is designed to be used as a general-purpose patient list. When you click on Patient Master List, to the right you will see the different filters that this report has. One of the methods that you can filter out patients by on this report is by office. This is useful if you have more than one office within the healthcare assistant, and you want to go ahead and choose patients as they pertain to an office. If you only have one office, it's okay to select all offices. You can also filter out based on patient status. By default, the Patient Master List selects all patients. If you want to filter this report out and choose active patients, for instance, go ahead and uncheck where it says All and select Active. You can also filter out patients based on insurance. If you click on the drop-down menu, you can go ahead and select an insurance from your insurance library. What this filter will do is it'll filter out all patients based on their primary insurance. If you do not select an insurance, it will pull up all patients regardless of what insurance they have. The next two filters go hand in hand. They are the status date and the date filter. First off, let's talk about the status date. If I click on this drop-down menu, you'll see that I have two status date filtering options. I can either filter out by SOC date, which if I choose this option, it'll give me a list of patients whose start of care dates are within the dates specified in the date filter. I also have an admission status date, which if I was to select this one, it would go ahead and give me a list of patients whose admission status are within the dates selected in the date filter. There is also a third option that I can choose, but I have to enable within the patient filter the discharge or non-admit field. And if I do that, it'll give me my third option of discharge date. And based on the date filter below, will give me all of the patients in the system based on their discharge date. When utilizing the date filter, you get four different options. You can choose all to date, which will show all dates prior to the current system date. You can select current month, which will select only the records that fall within the current month of the system date. You can select current year, which will show all records that fall within the current year of the system date. And you can also select custom date, where if I was to select this, I will get two calendar pickers where I can choose my own custom filtering dates. I'm going to go ahead and select all to date. Now your report has different sorting options and other optional views. First off, with the Patient Master List, you can sort by patient name or by patient code, and you can choose either ascending or descending order. Ascending or descending for patient name will go either alphabetized or reverse alphabetized, while if I was to choose patient code, it will either start at the lowest number and work its way up, or it'll start at the highest number and work its way down, again depending on which one I choose. The Patient Master List has three different options. Two of them add more information to the Patient Master List report. The first one is the Show Admissions option, where if I was to select this, it'll print out additional admission information included on the report. If I was to choose the Print Patient Notes option, it'll go ahead and add on different kinds of patient notes to the Patient Master List report. The last option is a mailing label option, where if I was to print this report as a mailing label, we'll go ahead and print out in the Avery 5160 format the patient's names and addresses as they appear in the report. Once you have chosen your patient filters, go ahead and click on the print button to print the report. As you can see here, this is a sample of the Patient Master List report, where I have my patient name, address, phone number if entered, along with the policy number. If I was to select Show Admissions and print my report, this is what my report would look like, where I have my patient name, address, phone number, but immediately under it I have a start of care date, current patient status code, status date, discharge date if necessary, medical record number, my patient's primary diagnosis, who the physician is, and who the current case administrator is. Now, if I wanted to print out my mailing labels for my patients, I would go ahead and select this Print as Mailing Label option and choose my starting row and column. If it is a brand new sheet of labels, go ahead and leave it as 1-1 for both your starting row and column. However, if you are resuming print from a particular column or row, go ahead and set those numbers accordingly. This is a sample of what it would look like if I was to print out my patient master list as a mailing label. Again, these labels are based on the Avery 5160 standard format. If I wanted to print out these labels, I would go ahead and put my labels into the printer and click on the print button that appears here on the upper left. The patient census report is a report that will list patients that are active within a given period. This list is usually used to identify patients who are currently in treatment. It is also used to find out which patients were under treatment within a specified period. When I select the patient census report, to the right I have my different filters. I can filter out this report based on office. I can also filter out based on insurance. The date filters option has two different options for me to choose from. I can either select from patients that are currently active, or I can select for patients that are active for a specified period. If you select for patients that are currently active, you're taking a snapshot of all of the patients that are currently active as of the system date. If you want to take a look at all of the patients that were active for a given year or for a given month that passed, you're going to want to select active for a specified period and use the calendar tags to go ahead and select the time period that you're looking for. This is especially useful if you're looking for your duplicate and your unduplicated patient census for a given time period, such as last year or the year before. The patient census list has two different methods for you to be able to sort this information. The first one is by patient name, and second, you can sort it by zip code. And you can also sort whether you want it to be in ascending or descending order. The patient census report also has a couple of different options for you to be able to choose from. The show admissions options will go ahead and give me all of the admission status, diagnosis, and visit count summary for the episodes that are falling within the list. The print patient notes option will give me the option to be able to display all of the notes that are typed in the patient info. The option to show address line will give me the patient's address as well as phone number. And the show visit line will give me the patient's primary diagnosis as well as some of the visits that have been posted within the patient's ledger. Once you have chosen all of your filter options, go ahead and click on Print. This is a sample of the patient census report for all patients that were active within a certified period. As you can see, I get my patient name, patient code, policy number, birth date, start of care date, my current patient status, as well as the number of admissions that they have, primary diagnosis code, who their physician is, that particular physician's phone number, as well as their UPIN number. Towards the bottom of the report, you're going to see three different numbers. You're going to see an unduplicated patient count, a duplicated patient count, and the number of patients with readmissions. Your unduplicated patient count is the number of actual patients that you have within the healthcare assistant program. Your duplicated patient count is the number of admissions that you have within the healthcare assistant program. The reason why these two numbers vary is because a patient can have more than one admission occur within a given time period. If a patient receives more than one admission, that counts as a duplicate patient count because it's the same patient occurring multiple times. Your unduplicated count is just your number of actual patients. Here's a sample printout of the patient census report showing multiple admissions. As you can see over here, I have some patients such as Hal Gore and Dolores Lake that have multiple admissions. If I also scroll to the bottom of the report, I will see that my duplicate and my unduplicated patient census count differs. As you can see, I have duplicated patients as 25, while my unduplicated patients is 23, with my number of patients with readmissions is 2. This is a sample of the patient census report with the show admissions option selected. As you can see, I have a little bit more information over here. I have the standard information such as the patient name and code, policy number, birth date, etc. However, now I'm given more information. I'm given my current patient status as well as their primary diagnosis code. I have their start of care date and the number of visits that actually occurred per discipline. This is a sample of the patient report with the Show Address line option selected, as well as the Show Visit line option selected as well. With the Show Visit line option selected, you could see that I have more information available to me. I'm able to take a look at now my current primary diagnosis code in comparison to the primary diagnosis code that was selected when I was admitted, in case it changed. In the case of Hammer Armand, you could take a look at my current primary diagnosis code is different from my admission primary diagnosis code. As with both, you're able to take a look at the number of visits that have occurred within the episode. The patient list by referral source shows the patients referred to an agency by a referral source, such as physicians, hospitals, and others, as determined in the referring source's library. The purpose of this report is to determine the productivity in terms of patients referred by referring sources. It may be also used for other purposes, such as mailing lists. When I select patient list by referral source, I have different filter options that appear on the right. I can filter it out based on office, and I can also filter out based on patient status. You can further filter out by insurance, or if you want to select a particular referral source. You have different date filters. You can either filter out based on start of care date, admission status date, patients that are currently active, or you can select no date filter, and it'll just pull up everybody regardless of date. Either date filter that I choose, you're going to want to enter in a from date as well as a to date. You can sort this report by patient name or by patient code, and it can further sort either in ascending or descending order. You have two different options to choose from when printing out this report. When I select the print details option, this particular box will include the patient's mailing information, as well as contact phone number. If I select the Show Admissions box, this is going to add on to the report the patient's admission information. Once you have selected your filtering options, go ahead and click on Print. This is a sample printout of the patient list by referral source. This report is grouped first by referral source. It'll go ahead and give the name of the referral source as shown here. Next, it'll go ahead and categorize all these patients based on that particular group name. Next, it'll go ahead and categorize all of the patients based on referral source. At the end of the report, you will see a summary that'll list the referral source, the number of patients that this referral source has given, as well as the number of admissions that this referral source has contributed to. Lastly, it'll show you the number of active patients, and it'll give you point totals towards the bottom of this particular summary chart. To print out the patient list by referral source, go ahead and click on the Print button onto the upper left of the report window screen, called Print Report.